Welcome back to OpenLine. As promised, we have that number for you from the Tennessee Justice Center. I'm sorry, I keep saying system. Tennessee Justice Center. We want to give it to you because I know that we have sparked some questions for you tonight that you say, wait a second, I think I need some help with this. So we're going to put it up on the screen. And Michelle, if you don't mind saying it as well, here we go.
615-255-0331, and it's just on the screen there.
Yeah, we will leave it up for a second here and we'll show it again before the evening is over. We were just chatting during the break and I asked you when a woman is pregnant, how long she gets to stay on TennCare after that pregnancy, because there is a postpartum period when you still need care.
Exactly, and the answer is 61 days. So 61 days after a baby is born, a mom loses coverage, and what we found, maternal mortality is going in the wrong direction for the first time in 20 years. And so the state did a report on the moms who had died, and they found in 2017 that 78 women died between that day 61 and the baby's first birthday. And 85% of those cases, when they looked at their medical records, that was preventable. Those were preventable deaths. So this is...
So things like what? What would have been preventable?
Well, heart disease, you know, underlying health issues. Preconception care is vitally important, but you don't qualify for because we didn't expand Medicaid, you don't qualify to see a doctor until you're pregnant. So if you have some underlying health condition, a heart condition, a lung condition, a baby puts a strain on your body, and then by day 61 you've lost coverage, and so we have 78 women that could be here today taking care and being mothers to their children, but who aren't here. And that, that's the kind of problem that if healthcare wasn't so politicized, we would roll up and we would figure out how to solve.
And this is a number, I mean, this is a trend that we're not seeing across the nation.
Well, we are at the bottom of the nation, and we went in the wrong direction. So honestly, we're not doing well as a nation as a whole, but Tennessee is doing particularly bad. And the same is true for infant mortality, which is, do babies make it to their first birthday? And over 500 babies died before their first birthday this last, the last time that records were kept. I mean, that doesn't make sense. Like, it doesn't make sense that we can't solve that. We know how to ensure that a baby lives to their first birthday in many, many cases, but if half the kids are born on TennCare and we're paying an HMO to provide that care, we have to get to the bottom of making sure that those kids get the health care they need to celebrate their first birthday.
We've also spent a lot of time talking about, for someone who is not using Medicaid or TennCare, whatever state they're living in, whatever it's called, they probably don't understand a lot of it because you've never had to deal with it. Understanding your own medical insurance plan can take up enough of your attention and time and brain space. But yet it's important for all of us to know what, I guess, the healthcare snapshot is across the nation for everyone.
That's right. I mean, I think Medicaid is really important. It's a 50-year-old program, and it's been vitally important to ensure that we have families having an opportunity to seek the American dream. And really, when you think about all your kids being in school with other kids, you want to make sure that everybody has access to getting illnesses treated. When we think about this virus in China, we want to make sure that people have health coverage so that they can get vaccines and so that they can be treated. It's been a really important program in the war on poverty. It's like, how do we ensure that people actually get the health care they need to thrive? And in fact, one of the motivations was during the Korean War was they had lots of young people signing up to serve who were too sick. They just didn't get health care as children. So how do we make sure that we have a future generation that has their basic needs met? And that Medicaid has played a vital role, and it works. It works. Children are more likely to do great things if they have comprehensive coverage. So how do we figure out a way to not blame children or blame their parents if they're oftentimes the vast majority of these parents are working multiple jobs, but they still can't afford health coverage for their kids.
And also I want to talk about seniors and how they qualify for this program. We've talked a lot about children, but what about seniors? Because this comes in a vital time where we have, people are, for the most part, living longer. Care is so very expensive, especially when we're dealing with Alzheimer's and such things. Who qualifies for Medicaid as a senior?
Well, so the cost for 24/7 care for seniors is about $100,000 a year, and not many people have that left over at the at the end of the life. And even if they have it 1 year, as people live longer and longer, thank goodness science is keeping people with us longer. But Medicaid pays for about 65% of the seniors in nursing homes. So long-term care is what I'm talking about. Medicare pays the vast majority of hospital care, or pays for some medicine. But what it doesn't pay for is this long-term care, and that could be home health care or it could be in a nursing home. And seniors qualify for it if they have, basically
nothing left of their own.
Not much left.
Yeah.
They can have a little bit left if they have a spouse that is staying in the community, but they qualify for it if they have a little, like a lower income. So middle class seniors, this 65% means it's not the poorest of the poor seniors, but it's seniors who can't afford $100,000 a year to keep getting the care that they need. And obviously there's a huge wave of boomers that are going to be needing this long-term care, and Medicaid has been a vital partner in that. And they actually, Medicaid rules sets quality of care standards at nursing homes that we all benefit from. If we have a loved one who's in a nursing home, rules that say you have to ensure that the person is clothed and they can open their own mail, all of that comes from Medicaid standards to say we want to treat people with respect and dignity. Yeah.
But it's also putting a lot of people, when you do have that spouse who's still living, we've told stories, I've heard stories of people who basically, they spend their life savings taking care of one person, they die, and the spouse who is living
has nothing left.
Has nothing to live on.
Right, and they've lost their home because if you sign up for long-term care, you put they could come after your house. And yeah, there is lots of work to do to make this system work for seniors and for kids, and really for Tennesseans who profess values of compassion and dignity and opportunity. We have lots of work to do, but I feel hopeful. I feel more hopeful than I have in my 25-year career, because I think people are connecting their own frustration with the healthcare system with their neighbors. There's been a lot of kind of push political, like deliberate political ways to divide us and to say, well, it's those children's fault that they need Medicaid. But for some reason, over the last couple of years, people are starting to connect. Wait a minute, this system isn't working for anyone. And when these politicians are playing games with those kids, it's like they're playing games with my family. And that's why I think you have this huge wave of healthcare voters, and that's why every single elected official in these debates, and as they're running for office, they're going to be talking about health care. And so really it's important for voters to get the information they need to ask the right questions and vote for the right candidates.
I'm glad you said that. I was going to say, what are the right questions? Because I feel like we watch these debates, there's a lot of talk.
Yes.
But then you elect these people and there's maybe not a lot of action.
Right.
So what are the questions that we should be specifically asking, saying, how do you stand on da-da-da?
Yeah, well, I think making sure that people are covered. And often politicians will say, well, the problem with health care is not that people need coverage, they just need to exercise more. Well, yeah, people need to exercise more, and if they don't have coverage is necessary, but not sufficient. But if you don't have coverage, you're destined to basically have medical debt, and then medical debt spirals. So what is your plan for making sure that everyone is covered? And what's your thoughts on surprise billing? Surprise billing impacts all of us. Do you have a way that you can work to ensure that people's high deductible plans, like that we have some way to make that deductible? Because the fact is, it's almost like having no insurance for many people because they can't afford that deductible. I feel like those are really important questions, and also, like, if we cover everyone, then it's cheaper for us who are covered. The average family pays about $1,000 a year because we have this huge number of people uninsured, and that when they're uninsured, the hospitals pass that cost on to the insured. And we have to figure out a way to get everyone covered. That's not because we think people are going to take advantage of us, or it's because we know if everybody's covered, then there's less uncompensated care, and it's a rational system. So what's the plan for that?
Sure. Okay, we're going to leave it right there. When we come back, the Tennessee Justice Center's number once again, and we'll give that to you in just a few minutes. Get ready for it.